Hey, I'm Dr. Joanna with Momenta Chiropractic, and today I'm going to share with you a few of our favorite exercises to prescribe for patients that work at a desk all day, and by the end of the day, they have a lot of upper back and neck tension. A lot of these symptoms that we're referring to come from a more forward-leaning posture throughout the day. So think my upper back is rounded forward, my shoulders are following, and then my chin and my head are tilted upward. So we're putting a lot of tension in the upper part of our cervical spine. So to counter this, we're going to take a band. I have a TheraBand here, though you can use whatever band you have around. To position yourself, you're going to take the band in your palms, where your palms are facing up toward the ceiling. Elbows by your side, and you want your shoulders to be basically positioned back and down and not shrugging up toward your ears. Then you're going to retract your chin a little bit, so you're going to tuck the chin back to give yourself a little double chin just slightly. And from here, we're going to draw the band out toward the side. So we're going to pull the band laterally, and as we're pulling the band, we're going to pinch our shoulder blades together so that we get that activation on the inside of the shoulder blades. So we're squeezing shoulder blades together. I'll show you from the back as well so you can get a better idea. So I'm standing up in a neutral position. I'm pinching shoulder blades together as I'm drawing the band out to the sides. Again, that's going to be pinching shoulder blades together without shrugging my shoulders up like this. This is a great exercise to do to start working on scapular stability and help us maintain a proper, more neutral shoulder position throughout the day. Being in one static posture throughout the day can also contribute to this pain. So rather than being stuck in one position all day long, we want to get some movement throughout your cervical spine. So I'm going to show you an exercise called a cervical CAR. CAR stands for Controlled Articular Rotations, and that essentially means that we're going to take your cervical spine through its entire range of motion. So to do this, it's going to look similar to kind of doing circles with your head, what we often do like when we're trying to get relief throughout the day if we're feeling a little stiff. But I like to think of these as a little bit more intentional. So to do this exercise, you're going to sit up nice and straight in your chair. Then from here, you're going to draw your chin down to your chest as far as you can. And then from here, you're going to lead with your chin toward your shoulder. And then once your chin is facing your shoulder, you're going to tilt your head straight back. And from this position, we're going to round to the opposite shoulder. So now my chin is facing the opposite shoulder, and I'm going to sweep back to the starting position. And then we're going to reverse that. So we're going to go opposite direction. Start chin down to your chest, sweeping toward the opposite shoulder. Tilt back from there, around to the other side, again leading with the chin, and back to the starting point. So a common mistake that you can make with this type of exercise is coming to the side and then tilting your head back with your chin kind of facing the wall in front of you. So you want to keep your chin tucked throughout the whole motion toward the shoulder. This is great to get full range of motion of the cervical spine and can often give you some relief if you're starting to feel any pain and tension in the neck. The last exercise that we're going to go through is a form of self-myofascial release, and all you need for this is a lacrosse ball or a tennis ball if the lacrosse ball is a little too firm. So this is great for if you're having any upper back tension, particularly like one pinpoint spot that's really bothering you. You can take the ball and basically pin it right over that area, and you can go ahead and move the ball around so you're working the soft tissue around that area. You might get some sort of release from that or relief. You can also make this a little bit more dynamic by adding some arm movement. So you can pin this ball over whatever spot is bothering you most. Take your arm out to the side and then bring your arm across toward your opposite knee and let your head follow that same pattern. So we're kind of coming up, arm out, and then you're reaching across and down, and let the head follow. And you might feel that that feels a little bit deeper, might get a little bit more relief from that type of movement instead. These are just a few of our favorite exercises to do. They don't require a lot of equipment. They're easy to do right at your desk, and they're effective at getting rid of your pain. So go ahead and give those a try and let us know what you think.